You're listening to the Aesthetically Speaking podcast, presented by Nextech.
Good morning, Nextech listeners. I'm Robin Into, and welcome to the Nextech podcast. I am live at the MedSpot show here in Las Vegas at the beautiful Wynn Hotel, and I am excited today to have our special guest, Uma, and she's a nurse practitioner out of Atlanta, Georgia. Uma, tell us a little bit about you.
Thank you so much for having me. I'm so excited. My name is Daya. I am a board-certified physician assistant specializing in aesthetics. I work in Atlanta, Georgia for Rudderman Plastic Surgery. Huge fan of Nextech, so I am so excited to be here.
I can see you're excited, and I love the energy. That is one of the best parts about having the time with you and spending time with you, and I've had the opportunity to be in your practice. And so let's talk today about this journey that you've been on. When we think about the fact that you didn't always do aesthetics, and there was a point in your career where you must have said, I want to do something different. When did that happen, and what sparked that interest?
So I've been a PA for now 17, 18 years, and the bulk of my career is family medicine, and I love it. I always say that it fed my soul really well, and I really enjoyed it, but you know, as I started getting older, as I started having a family and insurance started happening, basically,
Yes.
the pressure was just, it was a lot, and it got to be quantity and not quality, and that's not why I got into the medical field ever. I luckily did work for a few practices that were amazing, but burnout is real, and it was time to take a step back of always being stressed out and just not doing enough, not being enough, not being able to be there for my patients the way that I wanted to be. And I got the opportunity to be in the aesthetics field, and it's kind of a no-brainer at that point. I've always been interested in plastic surgery, but just never really had the chance to, because that is a hard field to get into. And so when I got the chance, I jumped in.
Well, beauty is appealing. I mean, we think about all the scientific studies around it, and we think about where there's a natural attraction to beauty, but why not be able to live in it and show people where they've got opportunity? And I think that it's a beautiful journey that you've been on. When you think about, though, that historic knowledge that you've been able to gain over all the years that you've been in this business, treating patients for those medical concerns, where do you think that that is layered in a different level of expertise and how you can really understand and treat your patients, especially when we think about it as a truly medical type of procedure that you're doing?
So it is, aesthetics is medicine. It's not, people think, oh, it's vanity or it's cosmetic, but it's not. It's artistry mixed with anatomy. And so having that experience in family medicine, having that understanding of the human body as a whole and how that can affect the face, I feel that has helped me grow immensely, and also understand patients a little bit better, understand their faces a little bit better, and get them closer to their aesthetic goals.
When you think about, you said it so beautifully, artistry in aesthetics, and it's equal, it's what it is, what defines it. You're here at the show. Tell us a little bit about why this show is appealing and where the opportunity has led you.
This is a show that I've been wanting to come to for 3 years now. It's people that are like-minded that are here. They're not pushing products. They're not pushing an agenda. They are simply pushing skill sets. And I have so much to learn, so much to grow. And being here and learning and watching these people and listening to these greats tell me about their experience, how they assess a face, how they inject a face. It's mind-blowing, life-changing, all of the amazing things.
Well, you work with some great injectors in your practice as well.
Do.
And I find that it's not that you're not really great at what you do. I find that you're always continuously looking for that learning opportunity. That's part of one of the great things in life, is that you continuously want to learn. And I admire the fact that you see this as a learning opportunity and that people are here to teach as well as learn at the same time. So I would imagine there's things that you could teach people because you've been doing this for a while, but at the same time, you are learning as well. And so there's this give and take, this yin and yang, so much of it that, and I see it, I feel it. I've talked to so many of the injectors or not just injectors. You've got estheticians here. You've got true non-surgical providers here at this show that are really investing in not just learning how to manage the clinical techniques or learn about what are the new things that are out there, or obviously technology is a big part of where things are evolving and changing, and the devices that are here on the floor, just the trade show floor itself, and all the skincare lines. There's so many things that we continuously see where this industry is evolving and changing. And so I think that those that stop and think that this isn't for them and that they're not going to want to continuously learn or invest in learning from other people, I don't think that that's the right philosophy. I love that you're here and you're taking that on.
I absolutely agree. I feel like the medical field is always advancing in general, but the aesthetics field is advancing at such an it blows my mind.
It's exponential.
It really is. Thank you. That's what I was looking for. And I feel truly that if you stop learning, you shouldn't be injecting. That may be a hot take and maybe not, what people want to hear, but you have to continuously up your skills. You have to refresh your skills. You have to improve because everyone's face is changing, even Ozempic now. That wasn't around, and now Ozempic face is a thing. Mm-hmm. So staying on top of your game, continuing to learn, and of course, putting back what you've learned and teaching other people, it's a full circle moment. And if you're not willing to learn, if you're not willing to teach, you shouldn't be in the medical field, period, but you definitely shouldn't be in the aesthetics field because that's how we all grow. That's how we all get better. And the ultimate goal is taking care of our patients, making them happy, making sure that you're hearing them and that you're managing their expectations, but also you're doing right by your gut and your heart. You're saying no for the wrong patient. You're saying yes for the right patient. And you can only do that by learning.
Let's talk about saying no to a patient. What are some things that are indicators to you when you're talking to your patients that you would say they're not the right candidate, or maybe I can't meet their expectations? Let's talk about that. And how do you delve into that or kind of ferret that out in your conversations with them?
Consultation. The first step in all of my visits is a consultation or a full face assessment. I don't care if it's the first time that you've come to see me. I don't care if it's the 12th time you've come to see me. Your face is always changing. Asking you simply to raise your eyebrows, make an angry face, looking at your lips, just looking at those things without actually talking to the patient, seeing their faces animate, their expressions, all of those things. That is the most important step. The needle is the last step. So learning what their facial expressions are doing, learning, hey, you've got a little quirk, your eyebrows going up a little bit here when you say something, as opposed to if I say, hey, raise your eyebrows, you're going to raise them evenly. So watching those little quirks, but then at the same time, I'm watching your lips move, for example, and I'm seeing that, hey, you know what? Your lips are not going to benefit from lip filler, for example. Someone has beautiful lips. If I fill those lips with lip filler, they're gonna look artificial. I like natural, undetectable results. Now, if I'm talking to you and your lips are folding in, hey, maybe lip flip is a better option for you. So it's not always necessarily just saying no, but guiding the patient in the right direction. But that being said, if they're, bringing me a picture of Heidi Klum and they're saying, hey, I want to look like her, I'm so sorry. I would love that for myself, but not gonna happen. So managing the expectations and helping guide your patients in the right direction, as opposed to just saying no and I'm sorry, I can't help you. I think that's a big part of what I love to do.
So when you think about managing your day, if you're going to spend the time with the patient, that means that you've got to really set aside the right amount of time in your schedule. How much time do you like to have for someone that is a Botox follow-up patient?
So if it's a Botox follow-up, I'm going to take about 30 minutes with them. Okay. Especially if it's a new patient, if it's an established patient, about 30 minutes. If it's a new patient, 45 minutes. If I don't use that time, okay, I will film some social media. But I don't like feeling rushed, and I don't like patients waiting on me. Your time is just as valuable, if not more valuable than mine. So I like to put importance in that. And when you are in my chair, when you are in front of me, you have my undivided attention.
Let's walk a little bit through exactly what happens when they sit in that chair. What's the first thing you do besides have the open conversation with them? There's some standard step-by-step things that you do. For example, you probably talk about a consent or you might take pictures. Let's talk about those things.
So the very first thing that I always do is, hi, how are you? How was your day? Of course. And then I like to say, how can I help? That is the very first thing. I don't like to point out what is wrong with your face. Oftentimes, we are our own worst critic, and I'm not going to bring something to your attention that may not be on your radar. So that is always my first question is, how can I help? Or, and I learned this from Dr. Sunil Chilakuri when I went to one of his meetings, and he said, if I had a magic wand and I could fix one thing on your face, what would that be?
Oh, I love
And
that.
have them focus on that one area rather than, okay, tell me what I need done. That's not the right way to do an assessment, in my opinion. So step by step, build on their experience, build on the treatment plans. That's always going to be my first step. The consent, the photos, the needle is always the last step, but the consent and the photos come after that. The treatment plan, of course, this is what I aim to do. This is maybe what we can do today. Maybe we need to have you come back in 2 to 3 months, and this will be the next step that we're going to do. All of those things, then it's the photos, then it's the consent, and then it's the treatment.
Loving every bit of this. When you look at those photos and they're an existing patient, do you reference your previous photos very often?
Oh, absolutely. Absolutely. It's amazing. There are studies out there that show that for people that have those angry 11s, those glabellar lines,
Yep.
doing 5 consistent treatments of a neuromodulator that people think I'm never going to get rid of those ugly 11s, doing 5 consistent treatments of those neuromodulators will help soften those lines, if not remove them completely. I like to show that. I like to put my money where my mouth is and say, I told you that this was going to happen. So now let's look. This is where we started at the beginning of our journey, and look at where we are now. I want to show you that you investing in me, you investing in my practice, investing in me as a person, as a human, as an injector, it's been worth it. So before and afters are one of my favorite things to show patients.
How do your patients react when you show them that?
It's my favorite thing. They get really excited.
Really? Do they forget that that's where they started?
It's, the brain is an amazing thing. And it is such an elastic muscle. You truly forget what you look like. And that myth of you have to, once you start filler or once you start neuromodulators, you have to continue it. That is why that is something that people talk about. You forget what you looked like. You truly do. And you're used to now this look. When you stop it, you return back to baseline. You don't return, it doesn't get worse like people think, but you've now returned back to baseline. And your baseline is something that your brain is not used to being. And so that's why there is that myth. And so saying, hey, look, okay, sculpture, for example. Oh, I don't really see the difference. But look at what we started at 3 months ago. Sculpture is a very gradual, PLLA is a very gradual process. It's not instantaneous. So you're looking in the mirror every day. You're not seeing the changes like you would with filler or like with tox. And so I have had patients come in like, I don't think that PLLA really worked for me. And then we'll show them the before and now look at what you look like. And they'll say, oh, never mind. Wow, I do see the change. So it's great.
I love that you do that. Do you use photos as an education tool?
Absolutely. You have to. Everyone's face is different. And you bringing in a photo saying that you want to look like this, that is not always the right thing. It's usually not the thing because that's not your anatomy. And so showing people that, hey, if I do this, this is actually what you're going to look like, not your ideal photo that you brought in, your AI image that you brought in. Photos are very educational and like, hey, this is what filler migration looks like. If we do this, this is what you're going to look like. So I am saying no to you. So educating patients on that and on the flip side of, hey, this is what your potential could be with a before and after of like, this is my before and after for a sculpture patient. This was her at the beginning. This is her now. This is what I can do for you.
So patients give you consent. They sign consent to let you share their results, which help give patients an opportunity to really see what's achievable, what's realistic. But we go back to everybody's facial anatomy is going to be unique to that patient. And so there's that level of expectation that you as a provider are skilled at helping them see and understand as part of the education. photos are a great opportunity to educate. What other ways do you think about educating your patients?
I think the science behind what I'm doing and why I'm doing it, why I'm picking this neuromodulator compared to another neuromodulator, why I'm picking filler, why I'm picking a biostimulator, educating them on my logic of why I think these steps would be great. That is a big part of it, not just talking at the patient, but talking to them. Do you have any questions for me? You need to ask me the questions, because if you're a well-informed patient, those patients historically have better results. Their expectations are managed. You can always call me with any concerns at day 1, day 10, day 100. You can always call me. But I find that when I'm educating you on what I'm doing, why I'm doing it, this is what's going to happen, this is what the process is going to be, I get a lot less calls, a lot less panic. And when you're calm, mind over matter. When your body is calm, when you trust the process, you are going to heal better. So that makes a difference for me.
Let's talk about the well-informed patient. That's intriguing that you said that. How often do patients come in and they're misinformed and they've received education either from a different injector or Dr. Google? That happens. Tell me a little bit about where you have to reset and how that is managed in the consultation.
Social media is a big thing, and people come in and they have been on TikTok, they've been on Instagram, and I want this treatment. You don't know that treatment is not the right treatment for you. Facial slimming is a big thing now, and they come in and they say, I want masseter Botox. That's not the right thing. And a lot of these patients are now coming in, they'll take pictures of their face and they'll ask ChatGPT, hey, what do I need? And then these patients will come in and say, ChatGPT said I need all of this. ChatGPT is only looking at this. They're not looking at the 4D image. They're not looking at you. They're not looking at your micro expressions. They're not looking at you speaking. It is just a simple photo. And what ChatGPT is telling you, or what any AI is telling you, is not accurate. And so compared to when I first started my career and AI wasn't as big, a lot of these patients are coming in not necessarily misinformed, but not as well informed or well educated as I would like them to be. And that's why I take that time and spend so much time during my consultations with them, so that they understand why I'm choosing what I'm choosing and not what ChatGPT said. And sometimes ChatGPT is not wrong. Sometimes ChatGPT is right. Often not always.
That's fun. What about the patient that does come in that's well informed? What does that do in the consultation process? Does it make it a smoother journey and easier and faster?
Absolutely. A well-informed patient is always the best kind of patient. And that's during the process, before, after, and during the process. It's always going to be better, but it doesn't happen very often, simply because this is my career, this is my field. Most people don't know that. And so I love it when they're well informed, but even then, I like to just take it one step further to make sure that I'm explaining it to them in a way that is best practice, if that makes sense.
Okay. Yeah.
But yes, well-informed patients always make for a smoother process.
Going back and thinking about patients that you've treated, as you evolve and you learn throughout your career, and sometimes we learn as we do. Mm-hmm. That's a big part of learning. And it's part of thinking, okay, learning always, as you said, you're coming to this meeting to learn and never stop the learning process. Tell me about a time when you saw a patient and you, not necessarily there was an issue with what you injected or how you injected, but the follow-up afterwards, you said, I wish I would have. And you learn from some of those incidences where you didn't go down a rabbit hole per chance and get into a topic and really dig into it more. Have you ever had one of those incidences where you had to step back and say, okay, now I've learned from that, this is where I will approach this differently?
Oh, absolutely. Absolutely, I have. And I'm human. I make mistakes. And who I'm injecting is human as well. Sometimes a product doesn't sit how I expected it to do. I will always make it right. That is my philosophy. I don't want you going to somebody else to make it right. If I made the mistake, or if I used an outdated technique, or if it just didn't age as I wanted it to or sit as I wanted to, I am always going to make it right. That is my integrity on the line, and I will never, ever compromise on that.
I love that you say that. Let's talk about after the treatment. You mentioned that you give them your cell phone, or you really encourage good follow-up.
Yes.
Tell me a little bit about the empowerment of you managing that follow-up experience, because not everybody does that. There's a lot of providers that I've found that don't follow up, and I find that concerning because I think the patients, like you said, they don't remember everything. They forget where they started their journey and how far they've come. How do we expect them to always remember? Maybe they've seen you 5 times and this time you do something different, and they forget that you said you might have a little bruise, or I want you to not do this for 24 hours. Tell me a little bit about where that follow-up has been so important, because you've mentioned it a few times.
Absolutely. So, like you said, I do give all of my patients my cell phone number. They also leave my office with written directions, post instructions, because it's a lot of information that you get, and it's information overload, and you're not going to remember. You're overwhelmed by what I've done. I've said a bunch of things. You're not always going to remember it. So having that written out is critical. I typically will follow up typically at 10 to 14 days just to see how everything is doing. We as human beings put a lot of trust in medical providers, and that comes with a certain level of intimidation. And patients don't always feel comfortable reaching out and saying, hey, I'm not sure if this is normal. I'm not sure if this is settling how I want it to do, but they're scared to reach out to us. And you putting your trust as a patient, you putting your trust in me is the biggest compliment that I can ever get. You referring friends to me, you referring family to me, you trusting me with your face is the biggest compliment. I never want to take advantage of that. And so following up with you and knowing that line of communication is open from a patient-provider standpoint, it's always going to lead to a better patient experience. It's going to lead to a better patient outcome as well. And that's how I've always done it. That's how I will always do it, because I want that line of communication to always be open.
So just to close out the entire patient visit, the patient is left. What is the last thing that you really focus on that you have to do?
Clean up my room. Chart exactly what I do.
There you go. Charting part.
The charting is always the most important thing. I like to make little notes to myself. I like to humanize myself to my patients. And hey, if you talk to me about, hey, my daughter's getting married next week, or my daughter's getting married in a couple of months, or hey, I'm going on a vacation, or my dog was sick, I like to make those little notes because I want to follow up with that. I want to know when I contact you in 10 to 14 days, I want a reminder to myself, hey, ask this patient XYZ. But also charting, because I do see a good amount of patients a day. I am a super type A personality. I am very neurotic, and I have my charting. I want to document exactly what I did and where I did it. And I do that as soon as that patient walks out the door, so that I can either duplicate it or I can do better the next time if the patient didn't like how something settled or we did something new. What new did we do? So that charting aspect is very, very important to me, to make sure I document exactly what I did, where I did it.
I love that you really lean into the charting, but you've got the photography, you've got the consenting, you've got the education, and you've also got the actual visit, highly documented, down to those little humanized details so that you can actually know what to follow up with. I love that. If there was one thing that you could say about this medical spa show that you've really seen as a takeaway, and I know it's only been a day, and there's another full day of activities today. What did yesterday show you or teach you?
Because I am surrounded by like-minded people, yesterday just shows me how big our industry is, but how fast it's advancing. How much I still have to learn, how much I still have to grow. But also, I will be honest, I did give myself a few pats on the back of, hey, you know what? I am actually doing that as part of my practice. Hey, I actually did do this skill set, but also like sitting next to some people that are brand new injectors. And I remember my first conference that I went to, and being completely overwhelmed and not knowing, and reaching over to the person next to me and saying, what did that person say? And now saying that to somebody and what did she say? Did she say masseters? Did she say? That was really gratifying for me to kind of pay that forward. But I mean, it's always learning, just being surrounded by such amazing people, networking, and even the people on stage, or even the person sitting next to me, learning how they're injecting, learning how they're growing their practice, social media, follow-ups, whatever it may be. It's amazing.
So we're going to share a personal moment. Uma has actually treated my husband. And I can share that because I can share that freely. But let's talk about his experience for a second before we close out.
Adorable. Your husband was so sweet, and it was his first time getting injected.
I know.
That was,
And he's a burly guy because he's a fighter or he trains fighters.
Yes.
I mean, he's not your normal,
no.
suit and tie gentleman that's going to sit in a chair and be worried about this. This is someone that works in a gym in workout clothes all day.
Real men get treatments.
Exactly.
I wish that more people knew that. And he was such a pleasure to treat. And he was nervous, but I thought that was,
He's a big baby.
no, but it's a needle in your face. I mean, heck,
course.
I've been doing this for how many years? I've been doing Botox since I was 28 years old. I still get nervous. Having needles put in my face. But he was such a great patient. He was so cooperative. He did not move. He did all of the expressions. And then my favorite thing was that you guys went to Hawaii right after. And he was sending me pictures from Hawaii. And he was like, look at my face. Look at how good it looks. And I was blown away. But it was so fun having him in my chair because it was just... And we filmed it. It's actually it's on my Instagram. But it was such a great experience. But it was...
But you followed process, and I loved that about you. Because it was, I watched you and I said, wow, she's truly a real provider, process A to Z, and I thought that was amazing.
No, that has to be. Look, I don't care if you're a janitor walking in my door. I don't care if you're Brad Pitt. I don't care if you're the president of whatever. Every single person that sits in my chair is treated as if you are my friend, my family.
I love that.
It doesn't matter. And so you putting your trust in me to bring your husband in, biggest honor. But anyone that sits in my chair gets the full experience, whether, again, it's the first time that I see you or the 12th time that I've seen you. I will always respect and honor your time to me.
I love that. Well, thank you so much for joining us. I've had such a pleasure having you here. I was so excited that you were coming and that we could actually sit down and have this conversation because it's always so busy in the practice. But tell our listeners where they can follow you because you do so many posts. It's fabulous.
No, I appreciate that. You can find me on Instagram and TikTok at Aesthetically Uma. And then you can also go to our website, www.drrudderman.com, and I am on there as well.
Fabulous. Thank you so much.
Thank you for having me. And I love Next Tech, so always going to be a fan. Thanks so much.
Thanks for listening to Aesthetically Speaking, the podcast where beauty meets business, presented by Nextech. Follow and subscribe on Apple, Spotify, YouTube, or wherever you like to listen to podcasts. Links to the resources mentioned on this podcast are available in your show notes. For more information about Nextech, visit nextech.com, or to learn more about TouchMD, go to touchmd.com.